I've been working in the Medicare industry for 8 years, and in that time, I've seen the same mistakes happen over and over again from people who are brand new to Medicare and from people who have been on it for years. So, today I'm covering the top five. These are not obscure edge cases. Every single one of these is something I see constantly, and every single one of them is completely avoidable if you know what to watch for. So, stick around for number three. It's the one that catches people the most off guard, and most of them don't even realize it happened until it's too late. Mistake number one, thinking that Medicare is free. This is one of the most common assumptions people bring into Medicare. This is one of the most common assumptions people bring into Medicare. They paid into it in their entire working life through payroll taxes, so they expect it would be free when they finally get there. And I completely understand why people think that. But this is not accurate, and going in it with that assumption can seriously throw off your retirement budget. So, here is how the costs actually break down in 2026. Part A, that is your hospital coverage. It's premium free for most people. If you have at least 40 working quarters of Medicare covered work, which works out to be about 10 years, you do not pay a monthly premium for Part A. That part is true. Part B is a different story. Part B covers your outpatient care, doctor visits, lab, diagnostics, preventive services, everything that happens outside of your inpatient hospitalization stay, even if it happens at a hospital. In 2026, the standard base Part B premium is $202.90 per month, and that is per person. If you and your spouse are both on Medicare, that's $405.80 a month in just Part B premiums before you've used a single benefit. On top of the premium, there's a Part B deductible of $283 in 2026. You pay that once per year before Part B coverage starts covering your costs. Now, for hospital stays under Part A, there is a deductible of $1,736 per benefit period in 2026. And so, not per calendar year, which means if you have multiple hospital stays in a year, that cross benefit boundaries essentially, and that deductible can apply more than once. So, then there's the IRMAA, short for the income related monthly adjustment amount. If your modified adjusted gross income from 2024 tax return, which is 2 calendar years prior to the year we're in now for reference, is above $109,000 as an individual or $218,000 filing jointly, then you will pay more than the standard Part B premium, and sometimes significantly more. With the IRMAA Part B premiums in 2026, those range from $284.10 per month all the way up to $689.90 per month, depending on your income tier. Most people have no idea IRMAA exists until the letter from Social Security shows up telling them what they owe. And finally, there's Part D for prescription drug coverage, which comes with its own monthly premium on top of everything else, although some of those can start as low as $0 per month. So, Medicare is not free. It is heavily subsidized, and for most people, it is still very affordable and relative to what private insurance costs. You do need a budget for it beforehand and not after the fact. So, mistake number two is using COBRA to delay Medicare. This one's very expensive. The reason it keeps happening is that COBRA feels like a safety net. You leave your job, your employer tells you that you can continue your current coverage through COBRA for up to 18 months, and it sounds like you have time before you need to deal with Medicare. You do not. Here's the rule that most people do not know. When you leave your job at 65 or older and lose your employer coverage, you get an 8-month special enrollment period to sign up for Medicare without a penalty. That 8-month clock starts the month after your employment or your employer coverage ends, whichever comes first. COBRA does not pause that clock. COBRA is not considered credible coverage by Medicare. The moment your employment ends, your 8-month window starts running, whether you're not on COBRA or not. So here's what happens. Someone leaves their job at 65. They go on COBRA for 18 months thinking they're covered. They have time. The 8-month SEP window expires in the background without them realizing it. COBRA eventually runs out. Now they try to sign up for Medicare, and they've missed their special enrollment period entirely. The result is a late enrollment penalty on Part B, which is 10% added to the premium for every 12-month period that they went without coverage. That penalty is permanent for life. It follows you as long as you have Medicare Part B. At the 2026 standard premium of $202.90 a month, a 10% penalty adds about $20 a month permanently. 2 12-month period means 20%, 3 means 30%, and it never goes away. The fix is simple. If you are leaving your job at 65 or older, deal with Medicare first. Enroll in Part A and Part B during your special enrollment period. If you need COBRA for a short bridge period but for dependents or for coverage before your Medicare kicks in, that is a separate conversation, but do not rely on COBRA as a reason to skip the Medicare enrollment. Talk to someone first. But there's a group of people who are not receiving Social Security yet. When they turn 65, maybe they're still working, maybe they're waiting to claim Social Security at a later age, and they have to actively enroll in Medicare themselves. Some of those people sign up for Part A because Part A is free for most people and it feels like a safety net for hospital coverage, but they do not sign up for Part B because Part B has a premium and they don't think they need it right now. So what they do not realize is Part B covers almost everything outside of that inpatient hospital stay. Doctor visits, outpatient surgery, lab work, x-rays, chemotherapy, dialysis, durable medical equipment, mental health services. Without Part B, all of that falls on you. Here's the part that makes it even worse. Having Part A without Part B is not a complete Medicare setup, but it also does not stop the Part B enrollment clock from running. So if you were eligible for Part B and chose not to enroll and your initial enrollment period has passed without a qualifying exception, like being under an employer plan with an employer who has more than 20 employees, then now you are accruing a late enrollment penalty that again sticks with you for life. The Part B late enrollment penalty, again, 10% of the premium for every 12-month period we're eligible, but not sign up at $202.90 a month in 2026, and that adds up fast, never goes away. So the bottom line, if you're eligible for Medicare, enroll in Part A and Part B unless you have a very specific reason not to, and you've confirmed that reason is valid with a professional. Part A alone is not Medicare coverage, it is half of it. Mistake number 4, choosing a Medicare Advantage plan based on the $0 premium. Can't emphasize this enough. Turn on your television between October and December and you will see the commercials. $0 premium, dental, vision, hearing, gym memberships, groceries, call before December 7th. And for a lot of people, especially people on a fixed income, $0 a month sounds like the obvious choice. The problem is the monthly premium is just one number. It tells you almost nothing about what the plan actually costs when you use it. Here's what the commercials do not talk about. Copays every time you use a service, a specialist visit, a procedure, a lab test, prior authorization requirements, meaning the plan has to approve certain treatments or medications before they will cover them. Network restrictions, meaning you can only see doctors and use hospitals that are in that plan's network, and an out-of-pocket maximum that in 2026 can be several thousands of dollars for in-network care alone and higher for out-of-network if you have a PPO. Now, I've seen people choose a $0 premium plan and then find out their primary doctor is not in the network or their medication went from a low copay to a much higher one because it's moved to a different tier on their formulary, or they needed a procedure and it required prior authorization that took weeks. Before you choose any Medicare Advantage plan, ask these questions. Are my doctors in the network? Are my specialists in the network? Are my medications on this formulary and what tier are they? What is the out-of-pocket maximum for in-network care? What requires prior authorization? A plan with a monthly premium that covers your doctors and your drugs the way you need may cost significantly less over the course of a year than a $0 premium plan that does not. Run the full numbers, not just the premium line. That other option, other than the Part C Advantage plans, would be a Medigap supplemental plan. So definitely talk to a professional about how those operate. You might be surprised on how that coverage works. Mistake number 5, not reviewing their Medicare plan every single year during the annual enrollment period. I understand why this happens. You find a plan that works, you get comfortable with it, and you stop thinking about it. That's a completely human response, very normal. The problem is that Medicare Advantage plans and Part D drug plans are not fixed products. They get renegotiated and restructured every single year, and what your plan looks like in January may look completely different by the following January. Every fall, Medicare plans are required to send you a document called the Annual Notice of Change. It arrives in the mail before the annual enrollment period opens. It tells you exactly what is changing on your plan effective January 1st, whether it's premiums, deductibles, copays, benefits, doctor networks, pharmacy networks, drug formulary, any of it can change every single year and sometimes drastic. I would say most people toss it in the pile with the rest of the Medicare mail and never actually open it. Then January comes and their doctor is no longer in the network, or their insulin went from a $35 copay to a $90 copay, or the dental benefit they have been using for 2 years just gotten cut in half or eliminated altogether. And now they're locked in for the full year because they did not make a change during the annual enrollment period when they had the chance. The annual enrollment period runs from October 15th through December 7th every single year. This is your window to review your current plan, compare it against your current needs, and make a change if something better fits your situation. Even if you're happy with your plan, open the annual notice of change, verify what you have is still what you think it is. Verify your doctors are still in network, run your prescriptions through the formulary to see what they'll cost next year. Take 30 minutes and do the review. Your plan being great last year does not mean it's still great this year. Check every year. Let me bring all 5 of these together. Mistake 1. Assuming Medicare is free, budget for Part B at $202.90 per month in 2026. The deductibles and IRMAA if your income is above the threshold. Mistake 2, using COBRA to delay Medicare. COBRA is not credible coverage for Part B as in Bravo, although it is credible coverage to delay the Part D as in Delta for the prescriptions. Your 8-month SEP clock starts when your job ends, not when COBRA runs out. Mistake 3, enrolling in Part A and skipping Part B. Part A alone is not complete. You have to enroll in both unless you have confirmed valid reason not to. Mistake 4, picking a Medicare Advantage plan because the premium is $0. Please check your doctors, your drugs, your out-of-pocket maximum, and your prior authorization. Mistake 5, not reviewing your plan every AEP. Open the annual notice of change every fall, verify everything before October 15th through December 7th, and make sure that you're reviewing at least what you find yourself may needing for the next calendar year. All 5 of these mistakes are avoidable entirely, and now you know what to watch for. So if this video helped you, please like it, subscribe so you don't miss what's coming next. Drop a comment below and tell me, which of these 5 mistakes did you not know about? I read every single one. This video is for educational purposes only. I have 8 years of Medicare experience in the industry. This is not personalized advice. Please consult a licensed professional for guidance specific to your situation and follow for more education on Medicare.